Hello, and welcome to our third film aimed to help people with learning disabilities when they visit Southend Hospital. We've made this film to help our patients understand more about consent or giving permission for healthcare staff at the hospital to assess and treat you. It is very important that all our patients know that they have a choice and also how healthcare staff can support you to make choices. We hope this film helps you to understand the law about consent and what support you can get if you need to come to our hospital.
Sometimes you have to come to hospital for things like a blood test, an x-ray or even an operation. Before healthcare staff can carry out any tests or treatment, we need to have your permission. The law says that if you are 16 or older, you have the right to make your own health choices, but in some cases, parents can make choices on your behalf if you are under 18. The law also says that healthcare staff must explain information to you in a way that you can understand.
Before you leave home, pack your hospital passport. The hospital is a very busy place, so allow lots of time to get to where you should be. Don't be afraid to ask for help when you arrive. There are lots of volunteers who will help you to find where you have to go.
There are a lot of ways that healthcare staff can help you understand information and what will be expected of you. They can also help you explain or share your choices if you have additional communication needs.
There are different ways which you can give your permission, either talking or writing. The types of things that healthcare staff will talk about are why you need the treatment, what will happen, what the benefits and risks of having the treatment are, what happens if you don't have the test or treatment, what other options are available. They can also help you to understand which wards or departments you may visit. If it helps, you can take information about your treatment home to read or to talk about with family or friends before you make your choice.
Think about any questions you want to ask and write them down in a notebook. Ask someone who knows you well to come with you to your appointment. Take a look at the hospital website. There is lots of information here to help you when planning a visit.
If you are finding it hard to make choices by yourself, healthcare workers will assess your capacity. This means checking that you can understand information about the treatment you need. People cannot decide for you just because they do not agree with you. If the treatment is not urgent and you are able to make a choice for yourself, healthcare staff can spend time with you to help you understand the information. If you are not able to make a choice yourself, healthcare staff will discuss your treatment with people who are important to you and who know you well. The doctor will listen to everyone's views and make the choice in your best interest. If you do not have anyone who can help make the choice with you, healthcare staff will ask an independent mental capacity advocate, or IMCA, to represent you. The advocate is told who and where the person is, what decision is to be made and why the person needs help. The advocate will meet with you and try to find out what you would like to happen. They can use different ways of trying to communicate with you to meet your needs. They can talk to people who know you well and also the person who will be making the decision for you. They will sometimes read your medical records and other information to help them. Once they have done this, they will write a report about what they have found out. The report may give ideas on ways that healthcare staff can help you make the decision yourself. It also checks that they are treating you in a fair way. Sometimes the advocate will not agree with the decision and might request a second opinion. The advocate might ask the Court of Protection to make the decision. The advocate uses special laws to make sure the person has their rights upheld. They are called the Mental Capacity Act and the Human Rights Act.
Once you, your doctor or your representative have made the choices, you can have your treatment. If you need urgent treatment to save your life and can't give consent, for example, if you are unconscious, we will carry out the treatment and explain the reasons why once you are well again. This is the same for all patients and not just those with learning disability.
Sometimes people who cannot give the permission to stay in hospital to have treatment are assessed by healthcare staff to see if you are being kept in hospital for good reason. This is called Deprivation of Liberty Application, or DOLS. This means healthcare staff can keep you in hospital until they think you're well enough to go home. This will be discussed with you and those people who are important to you. Independent mental capacity advocates, or IMCAs, can help with this as well. It is also checked with a best interest assessor who does not work at the hospital. This is all to make sure we are doing the right thing.
Remember, the learning disability nurse is there to help you. Keep a note of her contact details.
If you would like any more information about consent, Southend Hospital is a learning disability specialist nurse who will be happy to help you with any questions. You can also find more information on our website at www.southend.nhs.uk. Thanks for watching.